Hi everyone, it's Janae with Daily Dental Hygiene, and today's topic is going to be about my absolute favorite patients to have in the chair, and that is my pregnant women. I think that it is so important to not only educate pregnant women about their mouth and the changes that will occur during their pregnancy, but to give them that OHI for their children. So I'm going to jump into it, why it's important to educate pregnant women on their mouths, what changes I see, and how to take care of those little ones. So let's start off with pregnant women. When you are pregnant, your body is going through an influx of, crazy hormones. It's very, very common to have extensive bleeding, inflammation, soreness of the gums, an increase of plaque in cavities is common because think about it. What do pregnant women do? They gain weight. They eat more. They're drinking more. They're consuming a lot more, and on top of it, the chemistry of their mouth is changing due to hormones. So it is very common to have a lot of those pregnancy gingivitis type of symptoms. And I tell these patients, hey, you're at a higher risk for cavities, periodontal disease, and things like abscesses. Make sure that your home care is absolutely amazing. And I tell them, and a lot of them have even told me like, oh God, yeah, I notice now when I floss, I'm starting to bleed and I'm not changing anything in my, my daily routine. I don't know why my gums are so sensitive. And I just help to educate them so that they feel that they are not going crazy and they have no idea why their mouth feels this way. Oftentimes I put my pregnant women on a 4-month recall instead of a 6-month recall because they build up faster, they're consuming more, they're at a higher risk of cavities. A lot of pregnant women have morning sickness, and that has a huge effect on the pH and the erosion of enamel. And on top of it, it's important to keep these women's mouth clean because bacteria from the mouth 100% can transfer through the placental barrier, and I do tell them this. So let's go over some of the OHI for pregnant women. So morning sickness is a huge one. Most women experience at least some sort of morning sickness. I tell them that this is very common. When they have an episode, to take warm baking soda, water, microwave it, and swish with it for at least a minute. So what that's going to do is, number one, your pH of your stomach is very, very, very acidic. Baking soda is on the opposite side of that pH scale. That is at a very, very basic pH. So putting those together will help neutralize the mouth back to a 7. I do see a lot of pregnant women after they have a child. Their enamel is totally weak. You can see the acid erosion in their teeth. A lot of them need crowns, fillings, and that's why a lot of women think that, oh yeah, when you're pregnant, you lose your teeth. Having babies, it causes, you to lose your teeth. It's not the babies causing it. It's the symptoms and the side effects of pregnancy that can definitely increase your chances. But there are 100% ways to take care of that. So talking with your dental professional and using some of the tricks and tips that I'm going to give you. On top of it, when your gums feel inflamed or you're noticing bleeding, make sure you're doing really good with your home care, a really good electric toothbrush, flossing daily, a good mouthwash, maybe increase your dental appointments. If you notice your mouth is tender and inflamed, use warm salt water and swish around with that for about a minute, and that will help to kind of pull the swelling, pull the infection, and pull that inflammation down. It's always a good idea to also add some hydrogen peroxide into it. Hydrogen peroxide kills bacteria, fungus, it kills viruses, it kills COVID, it kills everything. So if there is something in your gums or there is something, organism-wise causing that inflammation, it'll kill that as well. And the salt water is a really good way to just kind of soothe overall gum tissue. Okay, so now let's get into the home care of babies. So I talk about women, I talk to them about what they're experiencing, what they're going through, what they may in the future go through, just so they feel like they have the education for themselves. And then I tailor it to the little ones. And I get so much appreciation from my pregnant women because they're ecstatic to have a child. They want to do the best thing they can for their children. They love the education. There is no manuscript when you get pregnant on how to take care of your kids' teeth. And a lot of times they don't know. And so these kids get all these cavities or they get baby bottle rot with their teeth rotting out. And it's not the parents that are neglectful. They just don't know. They were never educated. There is no manuscript. They don't teach it in schools, unfortunately. So I'm going to go through it. Number one, I tell patients that teeth actually form at about 6 weeks utero. When you are born with all the enamel you're ever going to have. I know, that's a shocker. Most people don't know that. Yes, teeth form. Your palates form within the first 2 months of life. I tell them that everything pretty much forms within the first 2 months of life. Brain, spinal cord, your teeth, your organs all form. It's the last 6 months of pregnancy that you're physically growing bigger, but the most important things are growing at the first 2 months. When you're born, like I said, you're going to have all the enamel you're ever going to have. So it's really important to keep up with making your teeth mineralized. You see, as we eat things like acid or sugar or carbohydrates, that bacteria pulls away the enamel from our teeth. It feeds off of sugar, it feeds off of carbs, and it feeds off of things like acid. And it's important to remineralize your children's teeth as well as it is for you. I tell this to every patient, whether they're pregnant or not. When your baby is born, the minute you see teeth erupt, you need to start brushing them. Once teeth have come into the mouth, they are now exposed to sugar, bacteria, acids, milk, all of that, and will cause decay if they are not brushed properly. On top of it, I tell parents, do not put your children to bed with a bottle of milk once teeth have erupted into the mouth. This will be at about 6 months. This is very, very, very important because that milk has natural sugar in it. Apple juice has natural sugar in it. Grape juice, sodas, orange juice. Most of what we drink has sugar in it, and milk 100% has sugar in it. And if that milk is sipping and dripping onto the teeth all night, you will get what's called baby bottle rot, and it is where the teeth decay. And I have seen this personally. A child needs full mouth extractions and their teeth are completely black and rotted away, and it's very sad. A lot of people think and have the misunderstanding that, well, it's just baby teeth, they'll fall out. What do you think is forming underneath the baby teeth? The adult teeth. And if that bacteria is smart, which it is, it's not just going to eat away at the baby teeth and say, I'm full now. No, it's going to start dropping down into those adult teeth, forming underneath the roots of the baby teeth. And when those teeth erupt into the mouth, they will literally already be decayed. And that's really sad because those are the teeth that you have for the next 80 years of your life. And they are already compromised. They are already damaged forever. And you're going to need restorative work on those teeth forever. So please make sure you don't put your babies to bed with a bottle in their mouth. Only put water in a bottle. As well as something I want to talk about, the home care with children. So children need to have their teeth brushed when they are under the age of 3. Barely put a little bit of toothpaste. Put about the size of like an eraser head. Really small. I mean, like literally that much. Like 2 grains of rice, that small. You don't want them to ingest the toothpaste, and it's not until they learn to physically spit into the sink that I tell parents to introduce things like mouthwash. Usually at about 5 years old, depending on your children's ability, they can spit mouthwash. And mouthwash is great because it can coat the mouth, and if they don't clean very well, it at least gets those minerals into the mouth to help with being anti-cavity. So once they start getting past the age of 3, I say that you can add about a pea-size amount. So a pea-size amount is about that much. And you just put it on the toothbrush. And I always tell parents to encourage their children to spit. Make sure that they are spitting each time and rinsing their mouth out after. And like I said, once your child has shown you that they know how to spit, they are more than welcome to use an anti-cavity mouthwash. I love the brand Act for children. It has amazing flavors and it is amazing for cavities. I also tell parents to please buy their children electric toothbrushes. Children do not have the dexterity and fine motor skills to properly brush. They do this and then they're done. They don't know how to angle and get to the back teeth and get along the linguals. So get them an electric toothbrush because the electric toothbrush will do the work. They just have to put it physically to the tooth. The electric toothbrush will do all the work. On top of it, I used to be a nanny for a really, really long time and I've had a lot of experience. I used to work at a children's hospital for a year. So I have a lot of experience with children and pediatrics. and getting children to brush their teeth. Brushing teeth can be a terrible time with children. It can be that hell moment every morning and every evening, and I try to make things fun. When things become a game, they become light, they become more willing to be done. So when I was a nanny, what I would do is I'd have a few games that I would play. I would sit the child in the mirror, I would sit in the mirror, or I'd have them face me, and we'd do a copycat game. I'm gonna brush my teeth, and you brush your teeth, and then I'm gonna get to the backs, and now you're gonna get to the backs. And I would have them mimic the way that I brush my teeth so that they felt and understood that they need to hit all these areas, not just the fronts like this. Another game that I would play is I'm gonna brush your teeth and you brush my teeth, and they think it's super funny trying to get my teeth, and you know, they get to finally see kind of what it looks like on the inside of somebody else's mouth. Like where's the food stuck in my nanny's teeth? Oh, that's where it's going to be stuck for me. And I let them floss me, and it becomes a fun interactive game. And then I get to brush them, which is where I'm like physically doing a good job. Another game that I would play is the sugar bunny game. So I would let them brush their teeth. It's important to let children brush their own teeth. It is important to let them learn the fine motor skills and the dexterity to brush their own teeth. It is very hard to sit there and hold them and scrub their teeth. They're gonna fight, they're gonna kick, they're not gonna like to brush their teeth. On top of it, kids are very freaking independent. They wanna do everything themselves. They wanna brush their teeth, they wanna do their own hair, they wanna dress their own way. They're very independent. So I allow them to have the independence of brushing their teeth and let them feel that they have control and power. And then I say, okay, well, I'm just gonna go in and check for a couple sugar bunnies and make sure you got them all. And then I would take the toothbrush and I'd get in their mouth and I would do something cute and funny like, oh my God, I see one right there. And I'd scrub it really good. Oh my God, he jumped to the other side, and I'd jump to the other side, and I'd be brushing their teeth, and they're giggling and they think it's funny. And I'd be like, God, these sugar bunnies are hard to get. I think one jumped to your tongue, and then I'd be scrubbing their tongue. And I make it fun and interactive. You can also put a toothbrush in the bathtub. So when you're bathing them, you know, they could just be kind of munching and brushing around. Even if it doesn't have toothpaste on it, you're still physically removing plaque, bacteria, and food and stuff like that. So these are some really cool tricks that I use with my kids to get them to brush more. And I've seen this work a lot. And it's just really important. A lot of people blame their teeth based on genetics, and it's not. It's a home care failure on our part. You don't teach their grandparents. The grandparents didn't teach their kids, who didn't teach their kids, who didn't teach their kids. And so it becomes a line of miscommunication and a line of not enough education. So I really try to break that cycle every single day. Every time I see a pregnant woman or a woman that's trying to get pregnant or a woman that has children, I take it upon myself to not only educate her on her mouth, but to also go home and make sure her children have good home care, because I truly believe in breaking the cycle. Cavities aren't genetic. Cavities are made from bacteria, and bacteria is not genetic. It's environmentally inhabited and acquired. So if you can teach somebody good home care and they can teach their children, you can change a generation and a lifetime of, you know, somebody's mouth. So please educate your pregnant women and the women expecting, and even dads, grandparents, anybody that helps out with the children at home getting their teeth brushed. And let's help and save some teeth. So take care, everybody. Thank you for joining me with Daily Dental Hygiene.